Good afternoon to all the doctors and nurses and health professionals watching this video. My name is State Senator London Lamar, and I'm coming to you today to talk about a real conversation around how we can help better the services and the care that you give to women regarding maternal health and other issues. And I'm going to share my personal story today of how I got to this point where I'm so passionate about this issue and what happened to me in my lifetime that wanted me to be able to champion maternal health and many of these issues in the healthcare system. You know, when I ran for office, I ran on the platform of strong schools, healthy families, and safe communities. And that healthy families is key because in order for us to create a society where everybody's thriving and enjoying themselves, we must ensure families are healthy and they're getting the care and support that they need. And you are a pivotal part of that. And so today we're going to have a great conversation about, what my life story is and how I've used my life story to influence the legislation that I work on as a state senator. I'm sitting in front of you as one of the few women of childbearing ages in the Tennessee General Assembly. I'm the youngest woman and the youngest African American to ever serve in the Tennessee State Senate. And that is such a powerful moment because what I think about is my ability to really champion many issues that haven't had the necessary representation that they need and still don't have the necessary representation that they need in state government. But what's most important is that we are keen on everybody's cultures and everybody's lifestyle and how they are able to take advantage of healthcare opportunities in this state and making sure that you can give them the care that they need by having a clear understanding of their culture, who they are, their gender, and many of the societal implications that they go through that causes many healthcare discrepancies. So for me, healthcare has always been a big issue. When my parents divorced, my mother was raising me, and a year later, my grandpa died. And 2 months later, my grandmother got breast cancer, and she was a nurse. And so we moved in with my grandmother. So I was raised by my mom, my grandmother. And I would see my grandmother go to work every day as a nurse, and she loved her job, even picking her up sometimes from work and going to the window saying hey to her home patients or, interacting with nurses she used to work with in the hospital was just always an eye-opening moment for me of understanding that like nurses and doctors are so important. And I've always tried to take my healthcare seriously. I was a very somewhat active teen and everything, and I thought it was an important issue. And so as I got involved in the Memphis community, I got more engaged in policy around healthcare because I thought it was so important. And I remember back in 2014 or 2015, one of those years, the Amendment 1 was on the ballot. And what that would create a 24-hour waiting period for women who were seeking abortions. And I remember that was my first chance to really stay engaged on the idea of abortion and healthcare rights for women. And regardless of how you feel on the stance, understanding that's a particular healthcare services that women need for many of different reasons made me want to advocate with young people, get them involved. We went to Planned Parenthood and phone banking. I felt really proud of the work that I was doing at that time as a young Democratic leader, leading young people to get involved on important issues. And even though we didn't win, Amendment 1 did pass, I realized for the first time how important women's healthcare issues were to the community and why those opportunities should be accessible to us. And in 2015, my cousin, she died of pregnancy. I remember getting a phone call on December 15th, 2015 from my mother, and she called me at like 11, 12 o'clock at night. She was screaming. She was like, "London, wake up, Veronica's dead, Veronica's dead." And I was like, "What? What do you mean?" And she dropped dead outside of work. Now, leading up to that, that wasn't the first time she tried to have a baby. The first time my cousin tried to have a baby, she almost died at 5 months. She had a stroke, and she lost her first child, and she made it through after a few weeks in ICU. Then she got pregnant again, made it to 7 months, had that baby, lived. Then she got pregnant again. I remember the doctor telling her, "Well, I don't think you're going to make it through this pregnancy. You need to consider having an abortion. Your heart is not healthy enough." But she was so pro-life. "Oh, I don't do abortion," all these other things. And she tried to carry that baby. And now she and that child is no longer here. And my younger cousin, her son, is now without the mother. And so for me, that was my first on-hand real life experiences around how pregnancy and the maternal health process is difficult for women. You think think all the time, you see all these cute shows about women having babies and the OBGYNs and things like that, but you never really hear about the tragic stories until it hits home. On top of it's like this taboo topic. Nobody wants to talk about their issues around pregnancy and maternal health and the difficulties that they had. But that was my closest cousin, and I don't have a big family. And so it hit me hard because I'm thinking, wow, like, it's not all pretty like people make seems, or having all of these babies isn't as a cakewalk like we try to portray it as. And from then on, I wanted to double down in my advocacy around maternal health. Following that, I began a job about a year later working for a women's reproductive justice organization where I was working on different policies around Black women and women of color specifically having reproductive autonomy over their lives. And so I will work on legislation and policies on the local, state, and federal level around creating more healthcare access and more autonomy for women of color in regards to how they want to have their family, what resources they're able to access in order to have their family, and if they don't want a family, what resources they can have to prevent themselves from going through the childbirthing process. And it's important that people of color, especially in a city like Memphis, where people of the color are the majority populations, that we have autonomy and decision-making power and supporting how we are delivered services. And that includes demanding that our doctors are abreast on the cultural differences between women and some of the healthcare issues that different cultures go to. They play a part in our ability to have children. More importantly, we don't oftentimes talk about poverty and socioeconomic status, how women in lower socioeconomic statuses have a tougher time being able to access services, from being able to have private healthcare insurance or accessing public healthcare insurance, transportation, support, being able to take off work, somebody to keep their kids, being able to afford diapers, milk would contribute to the stress, being able to go see your doctor before you get pregnant to make sure you're happy, healthy, and also doula services, being able to afford additional services that can help aid you in your maternal health process. And so what it did, it made me a leader and a champion on these issues. And so following that stint at that organization, I decided to run for office back in 2018 because what we did was we needed more women to speak out about these issues and do work around those. And I did. And so I ran, I won, I became the only woman of childbearing ages in the Tennessee State House. And I was thinking to myself, wow, like, there were moms there, but most of them were, had grandchildren at that time and were probably out of the childbearing ages. And so, I felt like when we were talking about legislation around women's healthcare, you're talking about me. And that is the level of seriousness I brought to the work around women's healthcare, because if I'm your only representative at the time and I don't double down on policies to help you, who is going to help you, especially when you're working in a government full of men who can't even bear children? And while they can't bear children, they can be support, but they are not the ones putting their lives on the line. They aren't the ones who are in the grave like my cousin. And so I then came in championing issues around maternal health care. My first year, I pushed a bill that will give HOPE recipients an additional year if they get pregnant their senior year of college, because I figured we're in a state that's pro-life, then let me make sure you're pro-life in the duration of how you handle people in pregnant populations. And so if you wanted more kids to make sure they're getting a college education, that they're not on welfare, that they are not on all these different social services, then allow them to choose to have their kid without losing their scholarship money. Thinking creatively around how we support those individuals who decide to become parents. And so I pushed that. I was pushing bills around making sure women's in the prison system have maternal healthcare access, making sure there's dignity, even though they messed up in life. Their children that they have while in prison deserve a good start at life by making sure they have the healthcare services they need. And then I remember, my freshman year in the legislature, I was engaged with a man that I necessarily wasn't serious with, but I ended up getting pregnant. And now I'm this young single mother who has to carry this child out of wedlock in a very conservative religious state. And that was just a scary process for me because I was thinking to myself, well, at the time I'm 28 years old, like I'm kind of too old to be trying to have an abortion because I'm not in a very stable situation. So I had to just go forth with doing this. And it's not like I didn't always want to be a mom anyway. I think moms are the greatest gift to earth, to society. Like we carry the weight of the world on our shoulders and still press forward and bear our next generation of leaders, doctors, lawyers, and everything else. And so I decided to go forth and keep the baby. And it was tough because one, I was met with so much opposition. People were like so mean and judgmental to me. I'm thinking to myself, I'm a grown woman. Like, why is people worried about me not having a husband, or if I'm a bad image to other young girls by not having a child in marriage and all of those different things? And I'm gonna run against you because you're in a bad example. And I was stressed out and I was depressed most of my pregnancy because, I felt like there were my close circle of people who were supportive of me, but being an elected official, being in the spotlight, there was so much negativity surrounding me having this kid and not having this picture perfect image. And it just caused a lot of depression on top of the fact that I didn't have support from my child's father. They denied it. They thought I was lying. And I was just kind of met with so much difficulties. And I'm not rich. I live paycheck to paycheck like everybody else. And so I was stressing about how I'm going to find the money or what type of job can I get to make sure I can afford to take care of this baby that I'm about to have. But I did get a boy, which I really wanted. And I was really excited about that. So I remember many of my doctor's appointments, and I remember them being fairly short. Like I remember, they'll come in and take your blood pressure, blood work, and all of those things. And everything was healthy for the most part, definitely through the first half of my pregnancy. And I remember my doctor only seeing me for about like 5 minutes per visit. How you doing? Anything wrong? Check the heartbeat is fine. And kind of be on your way. And, I didn't think nothing of it at first, because I felt like, okay, I'm healthy, I'm fine, like I don't need too much. And then I was also trying to save money to pay those fees and then also pay for a doula because I was very privy to how doulas could help. But I was trying to get that money saved up so I could pay for it through the labor process because I already knew, like, I didn't want my family in there trying to stress me out and I'm trying to have a baby. And then I remember during my pregnancy, I developed gestational diabetes. I was eating unhealthy because I was suffering from depression a lot and just didn't have really much guidance on what does a healthy pregnancy diet looks like. Like most people don't know, I'm eating regular, like I'm not, and just keeping a very steady lifestyle on top of the fact that I was always craving cheesecake from the Cheesecake Factory because when I was feeling sad, that cheesecake was everything to me. So I was like really nervous because I'm like, okay, well, not really. I know diabetes is something that's in my family. My grandmother has it and other members of my family had it. But I was like, how do I got gestational diabetes? I've been eating bad my whole life. And then I would try to exercise a little bit, but I was starting to get really big because I'm a big girl. I'm like 5'10". I'm well over 200 pounds. And so I was like, whew, this is getting hard. And so I was also traveling a lot too because having to be at this legislative thing and this legislative thing. And I didn't want people thinking, in my first session that I was going to miss things because I was having a baby. I was trying to prove to everybody that I could still do it. So I don't think I could have was taking as good of a care of myself as I could have because I felt the need to always have to show up because I didn't have nobody to have my back and show up for me, on top of just all the stress I was going through. And I remember, towards October, right after I had my baby shower, went to a checkup and I was in my third trimester, and well into 8 months, and I had a high blood pressure reading. And she was like, well, if you come back next week and we'll, see if you have another high blood pressure reading. And so, we're going to sit you down and take some additional steps. And I said, okay, it's cool. So I went back to Nashville, had to do a summer study and appear before the committees because of my bills that I was advocating for, one for pregnant women and human trafficking and things like that. And I was still on the road back and forth. And so I remember coming back to Memphis after those and just laying down, preparing for my doctor's appointment the next day. And on October 17th, I remember waking up and I had these like sharp pains in my stomach for like 2 to 3 minutes. I'm like, what is going on? I was like, I know this is not a contraction. I'm reading the apps and stuff. I'm like, when do you start having contractions? And that wasn't to 9 months. I was like, that's weird. But I was thinking to myself, well, I'm going to the doctor later on today around 11 a.m. I'll be fine. We can check on it then. And then 5 minutes later, it went from these sharp little pains to the most excruciating pain I've ever felt in my life, where I was like in my house screaming. It felt like 1,000 knives were like stabbing me in the stomach. And I thought I was going into labor. I didn't know what labor felt like. I never had a kid before. And my mom like rushed me to the hospital, and it just got worse and worse and worse. And I walked into the hospital like screaming, and like really freaking the emergency room out. And so in the emergency room, they're immediately taking my blood pressure, getting the ultrasound machine. There was like no heartbeat. And they were trying to get it again. There's no heartbeat. And so they're calling labor and delivery to rush me over there. Next thing you know, I have like 5 doctors standing on me, rushing me across the hospital to labor and delivery. And my poor grandmother trying to follow up behind me, trying to keep up, because they're so terrified at what's going on and something's not right. And once they get me into the operating room in labor and delivery, I have like 7 nurses and doctors standing over me, all these machines and everything, just taking my clothes off to get to the kid. And I'm thinking, well, I'm about to have a baby right now. And they're trying to find a heartbeat, and they're saying that I can't find a heartbeat. I can't find a heartbeat. And I'm like, what? No, that's not true. And I'm starting to freak out. And the doctor looked at me and was like, the baby is gone. And I just remember my mother and my grandma in the corner just crying. I'm just on that bed, just screaming and screaming and screaming, just so upset that my child is dead. And I remember the doctor telling me, if you don't calm down right now, we're gonna get your pressure down, you're gonna stroke out. And my blood pressure was so high. It was like 200 something over like 180. I remember the one nurse said, well, we're going to have to get you to push this baby out. And I said, are you fucking crazy? I'm not about to like push this baby out, and I'm sitting here about to stroke out. And so I said, you need to take me into getting a C-section. I asked them to give me one on that while I was in that bed. And then another doctor was like, yeah, she can't go into labor. She can't push this baby out. And so I remember them handing me a sheet of paper, and I had to sign my name to approve the C-section. And next thing you know, I was out. And I woke up, tubed up. I had all of these things on me, the breathing machines and something on my legs, because apparently I couldn't walk. But I remember opening my eyes, and I was seeing my mother there in tears and just trying to hug me, say, it's okay, it's okay, it's okay. And I looked over, and it's this crib with my kid in there, and he's not alive. And I'm just so upset and sad, because like initially I'm just like, what a huge failure that I just couldn't bring my kid here. And just like immediately thought about like the whole world is going to know that I couldn't do it. Just because I'm already a public figure, everybody knew I was having a baby, and he didn't make it. And I was just crushed, because I've spent all this money preparing, getting beds, clothes, car seats, all of these things, and now he's not here. And I remember telling them, like, unfortunately, I felt like that moment was taken from me to really grieve, because in that moment I knew, being an elected official, I had to come up with the PR plan to handle this situation. And I immediately was like, don't tell nobody, keep this quiet, but go ahead and call the father and tell him, to come to the hospital, but tell him not to say anything. And so he came up there and saw the kid, and I had to look him in his face like, the baby looks just like you. How you go, put me through all the things you didn't put me through and denied, and now he's not even here, but he looks just like you. But he also told a bunch of people, and it got out. And within an hour later, I had all of these people in the community texting me, I'm so sorry, from everybody, from the governor, the Speaker of the House, my colleagues, other elected officials, friends, family. And I was upset, because I still didn't have that moment to just kind of take in my situation before I really had to come up with a real PR plan. And so in that moment, I couldn't really text people back. I couldn't even walk. But I had to call one of my closest friends, say, hey, I need you to write a statement for me. And I remember feeling so embarrassed and humiliated in that moment, but also confused about how did this happen? Because I thought everything was fine leading up to that moment. And it was just a very, very tragic situation for me. Like, I went from preparing for a baby to preparing for a funeral at 28 years old. And I'm thinking to myself, well, damn, God, like, why did you do that? Like, I mean, I don't deserve this. Like, what happened? And my doctor came and sent some people up there. Because I was elected official, they sent, folks from the Gov Relations office trying to all of a sudden give me state-of-the-art care. And I'm thinking to myself, where were y'all before this moment? After the fact, now I'm getting the state-of-the-art care. And I was just really, really upset, but I really still didn't really take the time to grieve because I had all of these things I had to do in order to prepare for this funeral and be able to really walk back into the world and without the kid that everybody thought I was having. And I made it through the recovery. I, ended up recovering from the C-section. I had the funeral, had a little nice statement or whatever, but I decided to kind of pull back and take some time for myself. And it was really, really hard. I never felt so empty in my life after that moment because while I didn't have the ideal situation, I always valued moms and I always knew I wanted to be one, especially the history that I was making as a young representative. I wanted to pass that on to somebody to carry my last name and be able to champion the work that I'm doing. And now that opportunity was taken from me. And I didn't know what to do. One, I had to recover from a whole C-section. Like, my boobs were getting ready to produce breast milk. So they were starting to dry. Couldn't walk. Now I had this ugly pregnancy stomach, these C-section scars, and I ain't got no baby. And it was just hard for me to look into the mirror. Then my face started breaking out because my hormones went out of whack until I started breaking out into these big pimple scars on my face where it was so painful. Like, I called a dermatologist, said, I feel like my face is on fire. You're starting to turn to bleed, and I can't touch my face, and I'm swollen. And I had to get that taken care of, and I felt just like an ugly mess. And it was one thing to look like that if you got a baby to look at. It was like, oh, okay, it's something that's worth it. But I got a mama's body, and I don't have no kid. And it was just like a very tough thing to look at in a mirror and recover and just try to rethink about what life looks like. And so I used the rest of that winter to kind of heal before I went back into session. And, it was interesting because, people looked at me and were shocked at my ability to bounce back. Like, I definitely didn't want to carry that chip on my shoulder because I was thinking to myself, well, I got to get reelected and I got to do well this session in order to continue doing this work. And so I will say the positive thing, my work really helped me get through because I'm a Capricorn, I'm a workaholic, and I care about my career. And focusing on in the legislature didn't let me all the way focus on the fact of my tragedy, but I was still suffering silently from depression because I wanted my child. Like, I wanted him. Like, I chose, despite all the pushback, to have him. And so it was tough. But I decided to use my power for good. And when I came back to the legislature, I decided to double down on maternal health care issues. And because, for me, being in a legislature full of white men who are conservative Republican, but will not spend money on additional healthcare services, and who gave me so much pushback. I talk about women of color having more difficulties in the childbirthing process. I'm no longer talking on the stand about these issues. I'm talking about my life that you see in front of you. You've seen me before then, and now I'm standing here as someone who almost lost their life trying to deliver. And so now when I come up to these podiums talking about more support for doulas and more healthcare services for women and maternal health, I'm for real. I'm a real life example of how our state and how our healthcare system are letting women like me fall through the gaps, and how you are aiding to us losing our children and also losing our own lives. And in that, I don't necessarily blame any one person. Like, I never blamed my doctor. I never tried to sue her or anything like that. And I've never talked bad about her because I don't think that she intentionally tried to not give me care or missed something. And she was always very, very nice. But what I do understand is that there needs to be more support around implicit bias training, meaning that there needs to be more training and support around how women of color and all the societal barriers we have to go to play an impact on our ability to deliver. And it made me force the health department to also give me more information about what are we doing in the state of Tennessee where Black women are falling through the gap. I watch the maternal mortality review very, very closely. And in their report, and even the most recent report, Black women are 4 times more likely to die than any race of women in the childbirthing process, and so are our babies. And so it ain't just us, it's also something that you're doing that we are falling through the cracks and that we are more likely to die than anybody else. So I've tried to pass implicit bias legislation and still push back because, unfortunately, my colleagues don't believe there's differences in people based on their race, which is absolutely ridiculous because every piece of data, scientific data that you see will show that there are differences. Black people suffer from high blood pressure, Black people suffer from diabetes more, and that contributes to how our state even treats Black people and people of color. Our communities less likely to have jobs, less likely to have good schools, less likely to have healthcare services, less likely to have transportation, less likely to have insurance, less likely to have anything. The environment itself is dirty. And what makes you think if we create a society where people like me got to live like that and the people that I represent got to live like that, what makes you think they're going to have the ability to have a healthier pregnancy like any other white woman who comes from a privileged household, who has a steady income, who's able to have a husband who isn't being predicated on by the criminal justice system to have their back? Like, there is a difference, and doctors and nurses have to be privy to those differences in order to adequately care for each of their patients because every patient is different. And so I know it's been tough during this pandemic for doctors because also my colleagues have waged an attack on doctors and nurses through this COVID situation of not respecting their opinion or their advice of what's supposed to do or the healthcare protocols like masks and vaccines and things like that. I'm not here to ruin the credibility of doctors and nurses. I value you, I honor you because the majority of you dedicate your lives every day to save everybody and give them the healthcare services that they need. But that doesn't mean there isn't a challenge for you to take that to the next level and do better. And so I want to use my personal story and my advocacy now as a state senator to further push laws and policies that are going to require you to undergo training that gives you more informational cultures, genders, socioeconomic differences of the patients that you potentially may care for. Because the reality of the situation is there is not an even distribution of services and support for people in our community. And if you're going to service people in the city of Memphis, especially a city that's majority people of color, then you're going to have to make sure you go over and beyond to make sure you're educated on the differences and how you can care for us. And, I still suffer from, depression sometimes. My need to want to be a mother is more powerful than ever. I don't want to necessarily do that single again because it's expensive. And I hated going to my doctor's appointments by myself. Like, it was a very lonely process. But what I do know is that be aware of how my doctor can care for me more. Knowing that I'm going to have the money to get a doula on board from the start or even before I think about having a kid to make sure I'm creating a healthier lifestyle beforehand. And I want to make sure that mothers know they have a voice in the legislature who not only just advocates for you just by virtue of a woman, but being that I've walked through the most difficult paths of this process, I have dedicated the rest of my life and if you found the courage to use my personal story like I'm telling you right now about how we can better help women. And so this is not a conversation to downplay any doctor or nurse, but this is a conversation to encourage you to, one, encourage you to take a deeper look into how you're treating patients like me, patients of color, but also to give you the encouragement to, one, join me on a Capitol and advocate to have more services and resources so you can do that, but also make sure that you are getting the education that you need. And so I do want to say I still love you, my doctors and nurses. I got your back, and I'm not going to allow our legislature continue to challenge, your credentials and, what you bring to society. But at the end of the day, I'm still going to hold you accountable. So I'm here in the fight. Healthy families is one of the main things I'm going to advocate for as a state senator, and hopefully continue to be a state senator after this campaign season. But that's my story, and I hope it helps you open your eyes to something new.